So going back to psilocybin mushrooms, and this is why I think psilocybin mushrooms is a form of it's a form of liberation. It brings you back into nature. It increases nature relatedness. And for those of you who are skeptics about psilocybin, go to clinicaltrials.gov. As of this morning, there's 250 clinical trials registered at clinicaltrials.gov, which the FDA requires anyone doing a clinical trial, if you want it to have U.S. government eventual approval, potentially as a new therapy, a new drug, you have to register at clinicaltrials.gov. 250 clinical trials. 10 years ago, there was one or two, maybe a few more than that. But now they have to go through IRB boards, institutional review boards that are populated by experts, physicians, scientists. They have to address something that's not being currently addressed, adequately in the medical field. They have to have a probability of success. They have to have low toxicity and be applicable, whether it's scalability or other nuances. So 250 IRB boards, which is typically between 6 and 20 scientists and experts, approve these clinical studies. Psilocybin actually has a PR problem. It sounds too good to be true. But thankfully, I'm talking to a neuroscientist. Everything that we do is influenced by the health of our nervous system, our neurology. We live in a neuroscape, perception, our consciousness, our ability to walk, our ability to taste, to eat, to socialize, to breathe. Everything is rooted in the health of our nervous system. All suffer from neurodegeneration as a consequence of age. We suffer also neuropathies due to diseases, stresses, viruses, all the other things are quite obvious. We have Parkinson's, we have dementia, traumatic brain injury, we have Alzheimer's, et cetera, et cetera. All those studies are in clinicaltrials.gov, from Yale to Harvard to Stanford. I mean, check it out, folks. It's extraordinary. You can also put in psilocybin at clinicaltrials.gov. And if you're interested in enrolling like in a Parkinson's study, you can put in Parkinson's. Maybe you know somebody who's qualified to enroll. So these clinical trials are numerous. They're all basically rooted in increasing the health of your nervous system. So I think psilocybin could be a nootropic vitamin that's help us all as we age. We all suffer from neuropathies that are age-related, and psilocybin seems to be a potential game changer for improving the health of our nervous systems.
I want you to talk a little bit about what it's like to use psilocybin therapeutically. Meaning, are you suggesting that everyone with Parkinson's take a heroic dose and go cling to a top of a tree? I assume not. But can you talk a bit about the different ways? And we've had James Fadiman and Jordan Gruber on. Can you talk a little bit about the various applications of using this very special class of psilocybin mushrooms?
I can talk about applications, but I'm a mycologist. I'm not a physician. I do not make recommendations. Let's be very clear about that.
Yes.
I report on the scientific literature. I can report on my own personal experience, but let's be very clear. I do not make medical recommendations on anything. I just report the facts, follow the science. There are other experts that can make recommendations. They're empowered to do so. I am not, but I am very much a student of this subject. And I have to say, I think psilocybin is the most important new molecular medicine that has been discovered in the past 100 years. I think it's a game changer for so many reasons. But in terms of the applications, most of the dosages that have been approved by the FDA are 25 milligrams of psilocybin. So let's just do the math here so people understand. Psilocybe cubensis is the most commonly consumed mushroom in the world, golden tops, and 10 grams of fresh mushrooms is 90% water. It's 1 gram. 1% of that typically is psilocybin. That's 10 milligrams. So that is 2.5 grams of dried mushrooms is equivalent to 25 milligrams. If you go to clinicaltrials.gov, 98% of the studies, maybe 97, are on the molecule. Population, 8.3 million Americans did psilocybin in 2023. I would say 8.29999 were all with mushrooms, not with a molecule. So there's a disconnect between clinicaltrials.gov The pharmaceuticalization is based on a molecule that can standardize. Now, mushrooms are variable. There's lots of different species, even though psilocybin cubensis is the most common one. But the real world experiences with mushrooms and the scientific clinical studies are with the psilocybin, the molecule. That chasm, unfortunately, I think, does not give us the full story.